Hello everyone. In this video, we're going to discuss about how to prepare yourself for breastfeeding. So the dictum for preparation for breastfeeding is that you have to prepare yourself during pregnancy, because during pregnancy, you have a lot of time to do the homework, to understand everything about breastfeeding, and to actually prepare yourself, because planning, preparation, and performance. So planning and preparation will eventually lead to a good performance. As you have seen in any event in your life, whatever has been planned and wherever you are prepared for, will you be able to perform well when it is actually needed to be done? Because breastfeeding has to be started soon after delivery. So you have to really plan and prepare yourself for the breastfeeding, because after delivery, you will not have any time to actually understand, because a lot of people, they just leave things to chance, that we will see when the baby comes into our lives. This is going to happen spontaneously, because it is something which comes naturally to a mother. But yes, though it comes naturally to a mother, but in that also, if you are well prepared, it's going to be much easier for you to actually relax physically, mentally, and emotionally to initiate the process of breastfeeding. So make yourself ready for breastfeeding. What does that mean? That you have to check your nipples, because the breastfeeding is going to start with the nipples being in a proper condition. So as we will go further, you will understand what you need to check in the nipples. You have to gain more knowledge and bust the myth, that is what is supposed to be done after or before you actually initiate the breastfeeding, because it's a very intimate process that you have to undertake with your child. Also, getting motivated is very important, because in case you are not enough motivated, you will definitely understand that soon after delivery, soon after C-section, there's going to be some discomfort that's going to probably make you less willing to overcome your physical problem and to start breastfeeding. But you have to be enough motivated to start breastfeeding, because without that, the baby is not going to be, that satisfied, and that happiness is not going to be there. The intimate bond is not going to be there. So you have to be really motivated to start on with the breastfeeding as soon as you deliver, whether it is normal delivery or with a C-section. So what you need to do is, the first thing is to examine your breast. So naturally, you will go for self-examination. And if you find anything in the self-examination, you can always ask your obstetrician to help you understand what else needs to be done in the examination of the breast. So you have to see the size and shape, although it does not matter, but still you have to see that everything is okay. There is no lump that can be felt in the breast or the condition of the nipples. What are the changes that you expect during pregnancy? Is the first is the size of the breast is going to increase, as you see in this particular picture, that initially say it was this particular size, then it will grow to this size, which is seen in the outer boundary. And this is, all these changes are helping prepare the breast for lactation. The pigmentation, as you see in this particular slide, the nipple and areola around the nipples is going to become darker in color, and that is very normal. The colostrum leaking, as you see in this particular slide, you might come across that there is little discharge from the nipples during as early as 5th or 6th month of pregnancy. So please don't worry. In fact, that is a good sign, because that the breasts are being properly prepared for lactation. So you just have to keep a check on your fetal movements, that your baby is moving well. And then if you see that there is some colostrum leaking from the breast, it's absolutely okay. And If it's not as early as 5 to 6 months, it might start in the 7th, 8th, or 9th month of pregnancy. And this colostrum leaking is not actually a regular feature, not that everybody gets it. So if you are not getting it, please relax. That also is absolutely okay. And at times you will feel that the breast have become a little sore, meaning thereby that there is a little tenderness meaning a little painful when you press the breast, or while there is some exertion, and when there is something rough that you're traveling on, some jerks are there, so you will feel a little pain in the breast, so that's called as breast soreness. So in this process of awareness, we have to look out for the most important thing that you actually look out for in the pregnancy time is the condition of the nipples. So whether the nipples are inverted, retracted, or they are not well formed, that should be a major concern during pregnancy, because we need to prepare and we need to understand. For example, if the nipples are inverted, so what is inverted nipples? If you see from this diagram, there could be these variations in the nipples. So you have to check whether your nipple is normal like this, which is spouting out. And as you can very well understand from common understanding, that if the nipple is pointing out, pouted, then it's going to be very easy for the baby to take the nipple into the mouth and suck on the nipple. But if it is not pointed out, then these could be the different variations where there is either a absolutely flat nipple, which is not raised over the surface of the breast. It could be indented. The nipple could be indented. It is a little dipping from the surface of the breast, or it is very much tucked in. So, and you can grade the severity depending on whether it is flat, indented, or and tucked in into grade 1, 2, and 3 deformity. So you please check on your nipples whether it is normal or it is coming in the category of inverted nipples. So what you do, even a normal nipple and an inverted nipple has to be prepared. So inverted nipples will need more preparation, while normal nipples will need a little less preparation. So what preparation you have to do in the pregnancy time is you have to start massaging the nipples. Massaging the nipples, you should not massage. You have to be very clear on this, that though you understand that what is the condition of your nipples, but the preparation is going to begin somewhere around the 8 to 8.5 months of pregnancy only. I'm very specifically pointing out only, not earlier than that. Because if you start massaging the nipples in the early part of the pregnancy, there is a release of certain hormones which can induce preterm labor. And in fact, nipple massaging is also a way of inducing labor. That means if the labor is not beginning spontaneously on its own, you can start massaging the nipples, which helps in releasing of certain hormones, which also act on the uterus to cause starting of the labor pains. So for the preparation of the nipples for breastfeeding and for induction of labor, you have to start with nipple massaging. So in nipple massaging, you can take a little maybe Vaseline or any emollient, or maybe even I generally prescribe desi ghee. You can take a little bit of desi ghee in your thumb and your index finger, apply it on the nipple, and then start rolling. You have to start rolling the nipple like this. And in rolling this, it brings a massaging effect also. And if you, it also helps in oiling of the nipples and removal of the deposits. So you're just rolling it gradually, gently like this. So it's helping in there are certain ducts which are there, which open on the tip of the nipple, and there are certain deposits in these ducts. So if these deposits are not taken out, there will be difficulty in the establishment of lactation. Also, this oiling, this helps in removing the flakes. For example, if the nipples are dry and there are certain deposits like flakes on the nipple, that also will be cleared. So you start massaging the nipples in a rolling fashion. You have to take good diet, because finally the lactation is going to be established, and whatever is going to come in the milk is going to depend on your nutritional status, because everything is going to come from the mother's body. A few words on the different garments that can be bought or purchased beforehand during the pregnancy time is the bra, which actually opens from front. So there are certain t-shirts which you will see in the next slide, like this t-shirt is divided into two halves. So the upper half can just be lifted above, the lower half can just be slided a little below the breast, and with the help of the bra, which also has an opening on the front, the breast can be easily exposed, and the mother can feed the baby very comfortably. You can also go for certain garments like this, where you have worn the garment completely. This on the top, the baby is covered, your breast is covered, and you can comfortably feed the baby. One thing that I would like to mention here is that during the lactation, you are supposed to support your breast properly. Please do not leave wearing your bra. You have to have a comfortably fitting bra. So maybe the bra size might increase by 1 or 2 numbers. Keep yourself ready for that. Keep the bra ready before you actually, because even by the end of the pregnancy, you will have some idea about the size of the bra that you might need. So whatever size is there at the end of pregnancy, take one size bigger than that for the lactation, and support your breast properly. So thank you so much. That is all in this video, and hope to see you in the next video. Thank you so much.